most of the patients we get in functional medicine aren't simple. I'm always like, oh, I want a patient to just come in and tell me my finger hurts, right?
Yeah.
Hasn't happened. My
Yeah.
average patient has like 30 medical problems. They're on 30 different medications. They might even be on 30 different supplements. And where you're like, oh, where do I start? So I want you to take us to the gut, which is where I kind of cheat. And I'm like, let's just work on gut health. So can we talk about the role of the GI tract, the gut, on our immune system? And maybe some simple things we can do to just kind of get started in bringing that system back into balance.
Okay. So maybe you're going to say this is TMI, but I just had my screening colonoscopy about 2 weeks ago, right? But one thing I was thinking about after the colonoscopy is those guys are not looking on a microscopic level, right? All they're doing is saying, well, we didn't see any ulcers or bleeding or cancer polyps. We didn't see anything like that. So you're fine.
And you're like,
But
I'm not fine, right? I mean, not you, but I'm seeing a lot
yeah, but what about the
of
people say, well, I have gas, I have bloating, I have indigestion, I have abdominal pain, I have abnormal bowel movements, frequent or not frequent enough, so the people have all kinds of motility problems, and you don't see that on a colonoscopy. So yeah, I mean, I love the fact that we have gastroenterologists that can look to see that there's not terrible things happening on a macroscopic level that you can see. But the kind of problems we're talking about that are happening in our society are microscopic, right? A typical person has got something like 40 trillion bacteria in their gut. That's a lot of bacteria, right? A typical person's got about 3.5 pounds of some kind of fecal material in their gut. What's in there, right? It's a very complicated system. And there's now paper after paper after paper connecting abnormal mixtures of bacteria in the gut with all kinds of diseases, autoimmune disease, heart disease, mood disorders, etc.
right.
But we know that what the gastroenterologist can't see with the scope is really critical stuff, right? And we're getting there with our ability to do gut microbiome testing, where a person sends in a fecal sample and we look to see what's growing in there. I actually got through undergraduate school working in a micro lab, so I spent my days like putting things on cultures.
Oh,
We
you were that person. I always wonder who's the person that like scoops it out and
I'd like swabbing plates, and then you put little antibiotic disc on there to see what grows. But we could only study what we could grow,
yeah.
right? That's all we knew. And then came the advent of DNA testing. With DNA testing, suddenly we went, oh, there's more in there besides E. coli and salmonella and, you know, all the standard bacteria that you've heard about. There are tens of thousands of bacteria, thousands of species, and a lot of them we don't even know what they do. So we're right at a new frontier of being able to understand that.
And even, fast forwarding maybe a couple more decades, we will understand more about the metabolome, right? Like the overall metabolic activity of these microbes living within us. That might even be much more helpful than just counting who's there and who's not. But the technology is not there yet. We're getting there. And we right now we're not great at measuring function, right? We just kind of
Right.
look at structures, we do an MRI, that doesn't tell you about how things actually function in a normal,
There are a couple of labs, including one out of Stanford that Dr. Snyder put together. And I've actually done that test. It's a very interesting test. But you do a blood sample, and then it measures all these different metabolites, breakdown products of the things that we're eating or that the bacteria are producing. And we're starting to be able to read the tea leaves and understand what all that means. We're still not at that place, right? But you can imagine, like in the early days, not even knowing that blood cholesterol meant something.
right.
And then going from, say, we can look at total cholesterol. Now we can look at LDL cholesterol and HDL cholesterol. Oh, now we can look at LDL particle size. Now we can look at subtypes of LDL. We can look at lipoprotein little a. So we can look at all these different fragments. And the same thing's happening with the thousands of chemicals that are in our bloodstream at any particular time. We know that those chemicals in circulation alter and impact our immune system. So that's when I say it's the system that's important. So I had a patient recently with MS. She's on Ocrevus, right? It's not a bad drug as drugs go, but it does one thing. It knocks out B lymphocytes. B lymphocytes make antibodies, and it was helping her symptoms a lot. But it's not the whole picture, is my point.
Right.
Why did those B lymphocytes go crazy in the first place? That's the question. Was it the dendritic cells and the macrophages that programmed the T cells and the B cells to go awry? Is that where the problem is?
So this
Let's
is where
look at the system.
yeah, the concept of like going upstream and
Yes.
thinking about what came first and can we change those factors that are driving this autoimmune process forward? I think that's a really important question.